This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our HealthyU Webinar Series. Today's topic is fighting against obesity. What strategies are right for you? At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will remain anonymous. Today's presenter is Dr. Mehta. Dr. Mehta received her bachelor's degree at Macaulay Honors College at Hunter College in New York and her medical degree at New York Institute of Technology, College of Osteopathic Medicine. She completed her internal medicine residency at Garnet Health Medical Center in Middletown, New York, and she is currently pursuing her fellowship in American College of Physicians, FACP, and her certification in obesity medicine. Alrighty, Dr. Mehta, you have access to share your slides, and the floor is yours.
Okay, awesome. Thank you so much for the introduction, Jonathan. Hi, everyone. Thank you so much for joining me today on Halloween to talk about obesity. Let me just share my slides and then we'll start going, okay? Perfect. Does that seem okay?
Yep, looks good.
Okay, great. Okay, everyone. So thank you for joining today. We're going to talk about obesity and why is obesity so important and how we can work on fighting obesity for you specifically, right? So today what we're going to first talk about is what are your risks? Are you specifically at risk? What comorbidities it can cause? Different healthy lifestyle changes, diet, exercise-wise, we can do. Some behavioral factors that might be the cause of obesity for you, medications, and then surgery. So starting off, I just want to talk about obesity and why it's important, right? We hear it all the time in the news, on social media. Obesity is a national epidemic. Why is this so important? Obesity is, it's not the best of terms. People don't really love to hear when their doctor tells them that they're obese, or hearing that, obesity is a diagnosis that you have. But the reason it's so important is that it's been increasingly becoming more problematic in our population, especially in the United States. So the reason that's important is by 2030, which is just in about 7 years, we're going to have the highest rates of obesity in America. About, if you can look at this chart over here, you can see that most of these Midwest and the southern states are going to have about 50 to 59% of obesity rates. New York, specifically where we're at, is going to be having a 40 to 49% rate. And obesity in just our one generation has already tripled. If you can see these charts from 1987 to 2003, and then 2021 is the latest that we have. It has drastically increased. You can see it started off having about 10% risks of obesity, maybe not even any risk of obesity in 1987, to having more than 20%, and now we're at a state where it's we have states where there could be more than 40%. There are states that have 35%, and et cetera, et cetera. So what is obesity? Obesity is a disorder when we have more excessive body fat, and that body fat increases our risk for health problems. So where is this obesity coming from? Why are we having higher and higher rates of obesity now in the United States versus before? The reason is because of our culture. Our Western culture, we have more of a sedentary lifestyle, and we have a lot of changes in food, right? We all work very busy jobs. We have a lot of places that we can eat out. We have access to a lot of different types of food. We have access to a lot of ready-made food. We have access to a lot of fast food and a lot of processed food, which doesn't make for the best lifestyle decisions and choices. And so it has put us at a higher risk for obesity in the United States. Now, why is it even important that we talk about obesity? The reason is because it affects our health in a lot of different aspects. It affects our health physically, it affects our health chemically and internally, and also affects our mental health. But the most important thing is quality of life, right? The reason health is wealth is such an important phrase is because what's the point of living a long life unless we're living it healthy? What's the point of not having quality of life? So making sure that we address the obesity epidemic, address obesity risks in ourselves so that we can live not just a long life, but a long and healthy life. Now, I know there's a lot of stigma with obesity. Sometimes people think, it just has to do with eating poorly and not exercising, but there's a lot of other things that can predispose us to obesity. It could be genetics, it could be family history, it could be cultural, environmental. Sometimes there are some endocrine diseases and metabolic diseases that can lead us to having a predisposition for obesity. Sometimes there's a lot of excessive stress, which increases our cortisol levels. Not sleeping enough can be a big factor. Socioeconomic, maybe we don't have enough money to eat the healthier foods. Maybe getting lots of fresh fruits and vegetables is more expensive, and just eating cheaper meals is more cost effective. It could be lifestyle changes. It could be behavioral health. Maybe you're on medications that increase your risk of obesity. Maybe you have some behavioral disorders that actually put you at a higher risk for obesity. So we're going to talk a little bit more about that today. And so I wanted to kind of just give you guys a little background about how obesity happens, why this is important, and what it kind of leads to all these other health problems. So we all have something called adipose tissue. This tissue helps us with a lot of things. It helps us with energy storage, insulin sensitivity, transporting glucose and lipids. And so at a normal amount, it can do a lot of different things and help in a lot of different organs. However, when we have more high fatty diets, high in carb diets, low physical activity, this is when these adipose tissues replicate and become a lot bigger. When this happens, then we have more risk for inflammation. We have more risk for having lipid spillover, so we have a lot of bigger cells. We have more risk for hypoxia, which is cell death, and that can cause cancer. So a lot of when we're having these higher fatty diets, high in sugar diets, low physical activity, these cells replicate and get much bigger than they're supposed to, and it causes for a lot of other health problems, and it can affect a lot of different organ systems. It can affect our vasculature. It can affect our kidney function. It can affect our liver. It's going to affect our muscles, and all of this is going to affect insulin, metabolic rate. So, and here I put two little examples of hypertension and type 2 diabetes. So having a lot of this excessive adipose tissue is going to cause all these issues. Now, how do we measure your health, right? What most of your physicians usually use is a BMI, or a body mass index. And what a body mass index does is that it takes your weight and height into context to give us a value that kind of helps us rate whether you're aiming towards a healthier weight or a less healthier weight. So a person whose weight is higher than is considered a normal weight for their height can sometimes be put in a overweight or obese category. However, this the American Medical Association, or the AMA, has recently spoken up about it not being a very perfect clinical measure because it doesn't take into account gender, doesn't really take into account ethnicity. So it's not the best way for us to determine how your specific health is, but right now this is the only way we have to measure really that is more standardized. But I think, you know, the further along research we get, hopefully in the future we're going to have more means of finding out better ways to really assess for each person specifically what their risk is. Using body composition is another way. This is usually not used in a lot of offices because there's different equipment that needs to be done. For example, a bone scan can sometimes give us a good idea of body composition. Skin calipers, which are these little machines that is used to measure the excess of fat we have in different parts of our body. But most, you know, physician offices don't have equipment like this, so this is something that I'm sure we'll be able to have more access to in the future. Another way to determine or measure our health is waist circumference, and this has been shown to assess cardiovascular health. So people who are higher risk for that are men whose waist circumference is greater than 40 inches, and women who is greater than 35 inches, but it varies from race and ethnicities. I know South Asian and Asian men and women are higher risk at a lower value than Caucasian or Hispanic or Black. And then when you do assess your BMI, which you can do online, there's a ton of different calculators that you can put in. I think NIH has the calculator that I just showed on this page. And there's a bunch that you can download onto your iPhone or Android phone. When you do put in your height and weight, this will help us assess which category you're in. So values under 18.5 are usually underweight. 18.5 to 24.9 is a healthier weight. 25 to 29.9 is overweight. 30 to 39.9 will be in the obese range. And then this also gets categorized in obesity with stage 1, stage 2, stage 3, and then severe obesity is anything greater than 40. So what types of risk factors can happen because of obesity, right? Increases your morbidity and mortality. And the types of diseases that obesity can lead to are heart disease, high cholesterol, high blood pressure, type 2 diabetes, strokes, sleep apnea, arthritis, liver, gallbladder diseases, and something a lot of patients don't know about is cancer. So a lot of cancers you can have an associated increased risk with an elevated BMI. And some of the cancers that can commonly be highly associated with this is breast cancer, colon cancer, esophageal, gallbladder, stomach, kidney, and the list goes on and on. But when we improve our risk of obesity, when we improve our BMI, we can cause improvement in some of these diseases. So that's the important part of getting healthier. So how do we get healthier? Working on things that we can control, right? We talked a lot about some of the things that we cannot control, which is genetics or metabolic diseases, family history, et cetera, et cetera. But we're going to talk about today things that you can personally control. What I love to tell my patients is it's not about these short-term changes that we're going to do or short-term diets. It's more about long-term. How are we going to change lifestyle so that it's sustainable long-term and you're just learning to eat healthier forever, not just for a short period of time, right? So not just dieting, but having a healthy lifestyle means not going through these yo-yo diets, which we all have done, including myself, right? When we start up with a diet, we, do this extreme crash course diet where we lose a lot of weight, our metabolism slows. And then we get to this point where we're plateauing and we're not able to lose any more weight. And so we fall off. We fall off doing this crash course diet because there's no way to maintain a really restrictive diet, right? Because it's not sustainable. So when we fall off, our weight starts to return. And then you just go into the circle of diet, plateau, fall off, relapse, et cetera, et cetera. So how do we kind of prevent this? We want to work on long sustainable weight loss. And another reason that this happens is when you lose weight, the hunger hormone that was suppressed is now increased, and the hormone that you had that caused fullness or satiety decreases. And that's just a natural response. So when you lose a lot of weight, your body thinks, your body's hormone is going to release more of that hunger hormone. So you're going to feel hungrier, but that doesn't mean we have to keep eating. So how do we eat balanced for you? What I love to talk to my patients about is just having a healthy, balanced meal 3 times a day and a snack. Why? Because weight loss is mostly nutrition based, right? Having restrictive diets doesn't really help, doesn't help anybody. When we're on these restrictive diets, it's not sustainable for us, like we talked about the yo-yo diet. So what do? We eat in moderation. We cut down a lot of the foods that maybe are going to cause an increase in calories. Your body does need protein, it does need fats, it needs carbs, it needs all of it to sustain, right? So it doesn't help when we just cut out one part of that nutrition. It's important to have all of it, but to have it in moderation. So for example, things that we can cut down on: sugary drinks and alcohol, right? Just drinking water is probably the most important thing you can do. Sugary drinks and alcohol have a lot of sugar that is kind of unnecessary. Foods that are very heavy in fat, so fried foods, things that have a lot of fat in them, like bacon, steak, you can still eat them, but just have them in moderation. Foods that are really high in carbs, breads, pastas, rice, you can still eat them, but have them in moderation, right? Having adequate protein is really important, because protein helps us feel more full. So the more protein you have in your diet, the less hungry you're going to feel, and the better choices you're going to make for lunch and dinner. And different things I like to talk about with patients is, how do we adjust our plan for you, right? We all live very different lives. We come from different communities, different environments, different ethnicities, so we eat different types of food. We have different types of busy lives. Some people are taking care of children, some people work at nights. So having the same meal plan doesn't really work for everybody. So I like to talk to patients about meal prepping or planning. Sometimes that means setting your week up earlier, sitting down on Sunday, making a plan for the whole week, so you kind of know these are the things that I'm going to be eating or cooking. And that sets your whole week up, so you're not making last minute decisions when you're really hungry, and you can make really poor decisions. It also means sometimes prepping food. What I specifically do is I make overnight oats for myself for the whole week. When I have breakfast ready made for me for the whole week, I'm less likely to make poor decisions for breakfast, like eating a bagel. And I'm more likely to eat healthier and make better decisions for lunch and dinner, because I ate so well for breakfast. There's a lot of food delivery services. They can be pricey, but it works for some patients who are really busy. HelloFresh is one of them. Those kinds of food services kind of help teach you how to eat with proportions, not to eat over, but to eat the right proportion for one person. And sometimes when you're busy, things like that, having groceries delivered to you really helps. Trying to eat out less and cooking food more at home and eating together as a family is another way to really help. And if this stuff is a struggle for you and it doesn't really work for you, talking to a nutritionist or a dietitian is really helpful. I also talk a lot about mindful eating with patients, right? I think something that we do here is that we kind of overeat. We eat until we're like extremely full, instead of eating to like 80% full and being like, I am full, I don't really need to eat more than this, and just stop eating. Some patients really like calorie counting, because it helps teach them, if I was to eat 14,000 calories a day and I'm really hungry for a snack, if I went for a Snickers bar that was 220 calories, that would really put me over my calorie limit. But if I had an apple that was 30 calories, it really wouldn't, and I would be really full from that. Some patients do intermittent fasting. That could be very helpful for some people, but the whole point of intermittent fasting is that you're eating the same stuff that you would be, is not to overeat. Just because you're eating in a smaller time frame doesn't mean you should have an extra meal because you're not eating for 16 hours and you're only eating for 8 hours. And a lot of patients do Weight Watchers, which actually has been very helpful for them. So these are different things to look into that might be helpful for you. And this is just an example of what like a meal should be. I really am a believer in eating breakfast every day, because when you have a proper meal for breakfast, it makes you make better decisions for lunch and dinner. It makes you snack a lot less, and it sets your day up really well. So these are examples of how meals can be very balanced. A balanced meal, like I showed in this picture, should be half a plate of fruits and vegetables, 1/4 plate of protein, 1/4 plate of some kind of carbs or grains, and a little bit of fat. So every meal here, breakfast included half a plate of fruits, 1/4 of some protein, which is Greek yogurt, and 1/4 of some grains, which are the pancakes. For lunch, they had half a plate of fruits and vegetables, a little bit of grains, right, with the tortilla and some deli meats. For dinner, they had half a plate of fruits and vegetables, 1/4 plate of grains, which was the rice, and 1/4 plate of protein, which was the chicken. And then a snack included some nuts, which are high in fats and protein, and a piece of fruit. Now, we talked about decreasing sugary drinks. To me, this is really important. I feel like if you look at this chart, you can see how much sugar is in each drink that we have. And it's pretty significant. And I think what we do here is we drink a lot of sugary drinks, especially soda. It's really hard for me to get a lot of patients to stop drinking soda, but this picture shows you 15 tablespoons of sugar in one bottle is a lot of sugar. So if you stopped drinking that, I have some statistics. If you stopped drinking 2 cans of soda every day, that's 280 empty calories that you're having. And that over time, over a month, can be 8,000 less calories that you're having. Now, a lot of patients ask me, what about if I had low calorie or no calorie soda? I don't think it makes a difference. It makes a difference with the calories, but a lot of these artificial sweeteners actually make you crave more sugary foods. So even if you're having a low calorie or 0 calorie soda, it makes you make worse decisions for the rest of your meals because it makes you crave more sugars, so more carbs. And then how many calories are you drinking when you're drinking alcohol? Another question a lot of patients ask me is like, I go out on weekends with my friends and they're having drink after drink. What do I do? Sometimes a good suggestion is taking a break in between drinks. So, having a drink and then having a glass of water in between. But this picture here actually shows us how high in calories most of these drinks are. And you also want to make sure you're not drinking more than is recommended for you as a person. So there's different types of diets that you guys have probably heard about: the Mediterranean diet, the DASH diet, the keto diet. So we'll just talk a little bit very briefly about some of these. So Mediterranean diet, I think this is more of like a way of eating, which is actually really good. The benefits are it can decrease certain cancers, it can improve the liver function, kidney function, and it decreases cardiovascular risk. So it's more so eating a lot of fruits and vegetables, some grains, some nuts and seeds, some beans. So overall can be a very healthy way of eating, right? It's not specifically a diet, it's just a way of life or a lifestyle of eating. Having a high protein diet is good, but you don't want to overeat that either. You want to have, I think I had it in a future slides before, about I think it was 1 to 1.5 kilograms per day per person. So I think that is more beneficial. Ketogenic diet, I hear about keto diet all the time. So the thing with keto diet is you're eating higher fats and you're eating less carbs. And we talked about how your body needs carbs and your body needs fats. The reason your body needs both of these is because when you do high intensive activity, it's the carbs that are being burned. And when you're doing low intensity exercise, it's the fats that are being burned. So you kind of need everything. So what the keto diet does is that when you're eating higher fats, it's going to worsen your bad cholesterol, which is your LDL. The bad cholesterol, or LDL, is what causes us to have high risk for cardiovascular strokes, heart attacks, etc. So it's going to improve your triglycerides and your good cholesterol, but it's going to worsen your bad cholesterol. So that's not really that great either. And then very low calorie diets are also not so good. You want to have something in between. So what does that mean? There are a lot of apps out there that can help figure out and help you decide on what a low calorie deficit should be for you. Some of the apps I've used before are MyFitnessPal, Lose It, and Fujicate. What you do is you put in your weight, your height, and how much weight you want to lose per week. And I try to tell patients not to be overzealous and put 2 pounds per week, because that's really not possible, but try to put in maybe like 0.5 pounds a week. Usually for a calorie deficit for males, it should be around 15,000 to 18,000 kilocalories per day. And for women, it should be about 12,000 to 15,000. And throughout those calories, you should be getting about 10 to 35% of your total calories should be protein, 45 to 65% should be carbs, and 25 to 35% should be fats. Now, doing a lot of these apps are really helpful because they can kind of count out the calories for you, and they count out the total amount of macronutrients you're supposed to take into a day. So when you put in, for example, all the meals that you've had today, it'll tell you, you had a lot of carbs today. So maybe it'll help teach you to cut down on carbs. It'll tell you you didn't have enough protein today, so it'll teach you to add more protein into your diet. And then let's move on to exercise or activity. So a lot of times patients tell me, well, I'm very active at work, so that should count for physical activity. It doesn't. The reason it doesn't is because of your total daily energy expenditure, right? This entails 4 different things: your basic metabolic rate, which is your calories burned by your body carrying out basic functions like breathing, fidgeting, moving around, your physical activity, right, which is your calories burned during exercise, your non-exercise activity thermogenics, which are calories burned during non-exercise activities like walking or gardening, or when you're at work, and then your thermic effective food, which is the calories burned digesting your food. So really, your physical activity calories and your non-exercise activity calories are very different. And NEAT is what the non-exercise activity thermogenics is. Usually when you are doing less than 5,000 steps a day, it means you're pretty sedentary. If you're doing 5,000 to 7,500 a day, you're doing low activity. You're doing 7,500 to 10,000 steps a day, you're somewhat active. And if you're doing more than 10,000 steps a day, you're very active, which most people are not getting more than 10,000 steps a day, including myself, right? So that means we're not being as active as we should be in order to stay healthy. So how do we improve our health and our risk for obesity is to incorporate more exercise and physical activity. And the way we do that is for exercise not to become a chore, but to become a lifestyle. Recommendations for the minimal amount of activity we should be doing is more than 150 minutes per week of moderate intensity activity, right? So moderate intensity activity could be tennis, could be jogging, it could be running, water aerobics, dancing, swimming, riding a bike. And that should be done about 3 to 5 sessions per week. We have to also include resistance training 2 to 3 times a week to promote fat loss. And resistance training can be, using machines at the gym like bench presses and pull-ups, doing squats, doing bicep curls, doing push-ups, doing abdominal crunches. And this could be initially with body weight and slowly can move up with weights too. And that's also very important for women because it decreases our risk for osteoporosis. So usually preventing weight regain long-term, we have to keep increasing physical activity. So just doing this bare minimum activity is not enough. When we start to lose weight, we have to increase our activity to 200 to 300 minutes per week. I put up a couple of different ways or different things that you guys can look into, because how do we individualize it for you? A lot of patients are very busy, right? I don't have a lot of time to do exercise. They work, they come home, they cook for their families, they have to take care of their kids, they take care of their parents. Where do you find that time? I like to have patients kind of plan their week themselves and kind of figure out what works best for them. Maybe waking up just 20 minutes earlier or 30 minutes earlier from when your family's getting up. Maybe doing it immediately after work. I know for me, when I come home from work, I'm exhausted. So if I put on my gym clothes immediately after, it forces me to exercise. Maybe alternating with your spouse. If one spouse is taking care of the kids for half an hour, you can go take some time for you and exercise. Having an accountability buddy or a support system. Sometimes getting a personal trainer if you can afford it. Gym memberships, doing different classes, because you get to meet other people who also are kind of going through, wanting to get healthier. Kickboxing, yoga, bar, Pilates, CrossFit, all of these are really, really great ways to get more active. And some of these are different apps that you can use. YouTube is a great source because there's a ton of free classes, and Netflix has a Nike training club that has a lot of really good short clips and short workouts that you can do. FitOn is another app that really has really great classes on there too. So there are different ways that you can kind of adjust, but making sure you can talk to your doctor or somebody else about how do we incorporate exercise into your life so that you can make better choices. Some behavioral considerations to take into account. Is an eating disorder maybe the cause of your weight gain? Are you on any medications causing weight gain? Some disorders that could lead to predisposing you to obesity or put you at a higher risk are anorexia, bulimia, body dysmorphic disorder, binge eating disorder, night eating syndrome, sleep-related eating syndrome, and I forgot to add anxiety or depression. So if you think those are some of the considerations that might affect why you are at high risk for obesity, definitely would like for you to talk to your physician to see what the next steps are and how to help you better. And something else that we can do behaviorally for ourselves is just being more mindful. I think we talked about just not overeating, but eating until you feel like you're about 80% full. I think that's something that's very important when we're eating out and we're with family or friends and we're at a restaurant. We tend to just keep eating instead of realizing, hey, I'm kind of full. I don't really need to eat anymore. Something I like to do when I go out to eat, for example, if I went to a Mexican restaurant and I got a really big burrito, I'll cut it in half. I'll eat the half and save the other half for later. If I'm really hungry, then I might dig more into the other half. But if I'm not, then I'll substitute with a side of vegetables. Are you maybe struggling with emotional eating? Are sometimes emotions of like stress, anger, sadness causing you to eat? You're not really hungry, but having those emotions causes you to eat because it's a way for you to feel comfort. Sometimes that could be an issue. Are you binge eating? Do you sit and eat a lot of food at once and don't realize that you did that? Or are you sitting and eating a lot of food and feel self-conscious, so you want to eat a lot, but you don't want other people to see. And just trying to figure out what are your specific barriers to eating and exercise. Are you sleeping enough? Because when you're not sleeping enough, that can also put you at a higher risk for obesity. Are you sleeping about 7 to 9 hours a night? Are you waking up multiple times in the middle of the night? Are you, do you have sleep apnea? Do you wake up in the middle of the night? Do you feel really tired in the morning? Other things that you should talk to your physician about. And if you need even more help, Noom is a great resource. It's an app that really helps with the psychological issues and concerns with weight loss and getting healthy, getting a health coach if if you're able to with the cost, and maybe seeing a therapist who can kind of go through a lot of these things with you too. But small changes can allow for big results, right? If you make all these big changes at once, we're not really setting ourselves up for success. We want to be successful. We want to be successful long-term. We want to have sustainable changes. So we can do things little by little. And some of these are really great examples. Planning meals, eating half a plate of veggies at dinner, doing 10 minutes of daily meditation, making sure we have protein in every single meal, doing 10-minute daily walks, scheduling our workouts, doing bedtime routines, and doing journaling and gratitude journal. So those are different little small changes you can start off with and kind of slowly incorporate more and more over time. So medications, supplements, surgeries, what options are right for you? I'm sure everyone has heard of Ozempic by now. It's all over the media. It's all over social media. So I'm going to go through some of the different weight loss medications that are approved for weight loss, some that are not yet approved for weight loss but are being used off-label, and some of the side effects, and if you should talk to your doctor about these medications. So one medication, phentermine, topiramate, Qsymia, is a FDA-approved medication for weight loss. This medication is also used for topiramate is also used for headaches as well. The risks of this can be cardiovascular. So usually, if a patient is started on this medication, if they cannot have a history of heart attacks in the past. Naltrexone, bupropion is another medication that is FDA approved. Wellbutrin or bupropion is another medication that's also used for anxiety, depression. So it can help in that sense too. But however, if you are a patient that's on chronic opioids, this is not a medication that you should start. Orlistat, Ally, or Xenical is another medication most often used. It's used a lot less often now than it was before. Cellulose and citric acid, hydrogel or Plenity is something that's more commonly used in women who are breastfeeding, because when you're pregnant, none of these medications is actually approved for pregnant women. But when you're breastfeeding, cellulose citric acid is a medication that can be used. Liraglutide, semaglutide, and some of the names for that is Wegovy, Ozempic, Rybelsus. So currently, the only medication from this class that is approved for weight loss is Wegovy. Ozempic, although we hear about it on TV all the time, it is not approved for weight loss at this time. It is still just a medication used for diabetic patients. So some of the things that I think the media talks about is, all these actors and actresses taking the medication and it causing weight loss. The way it does that is by appetite suppressant. The risks of taking Wegovy can be a lot of GI issues. A lot of patients have to be started on a small dose and then incrementally go up on the medication. It is a injectable medication, so you do have to inject it into your abdomen weekly. And if you do have a family history or self-history of medullary thyroid cancer, then you cannot take this medication. Metformin is another great medication that we use for diabetics, pre-diabetics, and is used off-label for weight loss as well as for PCOS. And then Mounjaro is another popular one that a lot of patients are put on. However, currently it is still only approved for diabetic patients. It is used off-label for weight loss. So a lot of these medications can be helpful, but they do come with a lot of side effects. They do come with some risk factors. And they're pretty much medications that you will have to be on indefinitely. When you're started on weight loss medications, they are supposed to be done in addition to diet and exercise. They cannot be medications that you just take by itself, because what happens with the medications is that over time you will plateau to a point where you won't be losing weight anymore. And when that happens, you probably don't want to inject yourself with medication after that. And when you do stop the medication, you will have weight gain, and you will gain all that weight back. So making this decision with your doctor, talking about all the risk factors, the side effects, making sure you have a really good diet exercise plan in place is very, very important first before you go into starting a medication like this. And then dietary supplements. I have patients ask me all the time about whether dietary supplements really help. Some of these are green tea, Chitosan, raspberry ketone, carnitine, ephedra. So dietary supplements are not FDA approved, so you want to be really careful with what you take because they themselves also have a lot of side effects, and excessive amounts can cause toxicity, right? So any medication has risk factors, so you really want to make sure you discuss all this stuff with your physician before you start anything. How about bariatric surgery? Bariatric surgery, usually the criteria for bariatric surgery is a BMI greater than 40 or a BMI greater than 35 with comorbidities. Comorbidities include diabetes, high cholesterol, heart disease, et cetera, et cetera. So different types of surgeries that are available are gastric sleeve, Roux-en-Y, gastric band, gastric balloon, biliopancreatic diversion with a duodenal switch, Aspire Assist, and transpolar shunt. The most common ones that you usually hear about are gastric sleeve and a Roux-en-Y gastric bypass. Usually, if you want to discuss this, you would do this with a bariatric medicine surgeon. And this is a great resource also to have because you do have to go through a really long process of seeing a nutritionist, seeing a psychologist, really trying different aspects of diet exercise before you qualify for bariatric surgery. But bariatric surgery does have great indications of helping you decrease your risk for all the comorbidities and decreasing your risk for obesity, and has helped a lot of patients keep the weight off. So that's another thing to kind of discuss with your doctor if you feel like this could be an option for you. So just kind of to summarize everything we talked about today, usually if you have a BMI in the 25 to 26.9 range or BMI of greater than 27, we want to work on lifestyle changes to get you healthier. But if you're having a BMI of greater than 30 or a BMI of greater than 27 with complications, we can put you into different categories of obesity, and we want to work on lifestyle changes predominantly first, and then kind of see if we need to add medical therapy or surgical therapy. Okay. Thank you. Just want to say happy Halloween. Go enjoy some candy. Don't restrict yourself, but also stay balanced, meaning try to eat some fruits and vegetables in addition to having a candy bar today. Any questions?
Awesome. Thank you so much, Dr. Mehta, for your presentation. And yes, if anybody has any questions, you can enter them in the Q&A feature at the bottom of the screen. Your questions will always remain anonymous. I see a few here already. How much protein is in 1.5 kilograms per day?
So that depends. So I think that's why having like an app is a good way to measure. So for example, like Greek yogurt, if you have a certain amount of Greek yogurt, if you look at the label behind the bottle, it'll say if you have, I'm just bring this on the top of my head. If I have 2 tablespoons of it, then there's 16 grams of protein. So you want to kind of calculate, you want to just see what things you're eating, how much protein there is, and kind of calculate if you're eating enough protein per day.
What are the app names for calorie targets and counting that you mentioned?
Sure. The one I personally use a lot is MyFitnessPal. Some of the other ones I've seen are Lose It and Fujicate. So FOODUCATE.
Medications must to use in addition to lifestyle changes doesn't make sense. What is chiasmia? I have never heard of it.
Quizmia is the topiramate phentermine medication. It does make sense, right? Because the reason we have obesity, one of our biggest causes of obesity are our Western diet, more sedentary lifestyle. So working on diet and lifestyle is the best way to help you lose weight, especially because nutrition is about 70% of why we have weight gain. Now, could there be other causes? Definitely. We talked about so many different other causes, but that's why it's important to talk to your doctor to specifically figure out if there's something in addition to diet, exercise that may be the cause of your weight gain. So that you'll have to talk to them about.
How do you reduce visceral fat?
So you can't specifically pick and choose where you lose fat. When you have weight loss, you can't really choose where you lose fat, but all this visceral fat is the adipose that we were talking about that is the cause of obesity and the risk of all of these comorbidities. So all the stuff that we talked about today, diet, exercise, is going to help you decrease that adipose tissue, which is going to help decrease the visceral fat.
What about 12-step programs like Gray Sheet?
Unfortunately, I've never heard of Gray Sheet, so I'm not really sure, but maybe you could talk to your doctor about it and go through it and see if that is a good choice for you.
Can we get access to the set of slides to keep? Yes, I'll be sending everybody who attended the slides. Do you recommend a protein shake as a meal replacement?
So that's a great question. Protein shakes, I don't recommend as a meal replacement, right? I recommend as a supplement. So sometimes people have protein shakes prior to exercising, or they can use them as a snack to help them gain. When you're not able to get all the protein you're supposed to get through food, they'll use it as a supplement to make sure they get to that level of protein they need to have. But having more of a balanced meal for all 3 meals is better to do than having protein as a meal replacement, because then you're just having protein. You're not really getting the fats and the carbs. You're just getting the protein in.
I have no problem with diet during the day, but at approximately 12 midnight, I usually consume 300 to 400 calories. This helps me to sleep. Any assistance with this?
Yes,
I
so
am about
this is what we were talking about with some of the behavioral diseases. I would maybe talk to your doctor about night eating syndrome. That could be a reason why around midnight you get hungry and you kind of have to eat something for you to sleep. And sometimes if that is the case, getting a proper diagnosis and getting proper treatment for that will kind of help in that situation.
how to increase metabolism while we age.
Yes. All this stuff is kind of going to help, right? Like we talked about, our metabolism unfortunately gets slower as we age. It's really hard for it not to. So how do we kind of combat it? When we're eating healthier, we're exercising more, it's going to make our metabolism better. And I think most of us know, right, when we're starting to eat healthier, we crave healthier foods. We crave less of the unhealthy stuff. Same thing with exercise. The more we exercise, the better we feel. We want to exercise more because we feel like we can do it.
How can we contact you?
I work at the East Setauket office with Mather Medical Services on 3 Technology Drive. Our office phone number is 631-331-1000.
As a pre-diabetic, my doctor put me on 1,000 milligrams of metformin. Would an increase in the dosage be an option to assist in weight loss? And if so, are there side effects?
Usually the max amount of metformin patients are on are about 2,000 milligrams a day. Usually patients are on 1,000 twice a day. I don't know your specific type of metformin you're on because that makes a difference, but that's definitely something that I would discuss with your doctor and see if that helps you.
How many hours before you go to bed should you eat your last meal?
That's a really good question too. I definitely think there's no particular amount, but you would definitely think should try to eat 4 to 3 hours before going to bed so that you are able to digest, because when you're eating food right before bed, that food usually becomes a part of like where we get visceral fat from. So I would recommend about 4 hours before bed.
Right, and it looks like the last question, how to distinguish muscle from fat while trying to lose weight?
That I think you would have to do with the different body compositions. We don't really have any of those machines here to kind of distinguish from fat or muscle. Sometimes it's kind of hard to. And that's why a lot of times when people lose weight, they still have their weight still hasn't changed much because they're getting muscle. So maybe seeing if your doctor has any specific machines that can kind of help distinguish, doing like the skin caliper, but it's a little hard to find currently. Seeing if maybe your gym has something like that too.
Right. One more. I have observed that eating only 300 to 500 calories a day makes me lose weight. Eating 2,000 calories a day is too much to lose weight.
Um, 300 to 500 calories a day is very low. That's not enough to eat. We talked about for male and female, there's different categories, but it should be around 15,000 calories a day. If you're eating 300 calories to 500 calories per meal, that makes about more sense. Eating 2,000 a day, I think definitely won't help lose weight.
All right.
And you have to, oh, good.
No, you can go ahead.
I was going to say, you have to remember that when you lose weight, we have specific calorie deficits that we want, but when we want to maintain weight, we do increase those calorie amounts. So definitely things that you should talk to your doctor about.
All right, that looked like it was the last question. So I wanted to thank everybody for joining and thank you, Dr. Mehta, for your presentation. If you have any additional questions, please email them off to matherhospital@northwell.edu. Once you exit the webinar, you will see a link to complete a brief survey. If you can please complete the survey, your feedback is extremely important to us. That helps us plan our future programs. Thank you all again for joining today's webinar. And if you would like to view past HealthyU webinars, you can find them at www.matherhospital.org/HealthyU. Thank you all so much. Thank you, Dr. Mehta, and have a great day.
Thank you. Bye-bye.